The silent threat: understanding high blood pressure. High blood pressure, also known as hypertension, is often called a silent killer. This is because it usually doesn't cause noticeable symptoms at first. You can have high blood pressure for years without feeling sick. This is why regular checkups are so important. Early detection is key to preventing serious health problems. Many people don't even know they have high blood pressure until they have a heart attack or stroke. This is why it's crucial to understand this condition. Knowing the risks and taking preventive measures can save lives. It is responsible for approximately 12% of consultations in primary care. People are increasingly aware of the serious complications of high blood pressure. It is linked to stroke, heart attacks, kidney disease, eye disease, and vascular dementia. What is the link between hypertension, heart attacks, and strokes? High blood pressure means your blood is pushing too hard against your artery walls. Over time, this constant pressure damages your arteries. This damage makes it easier for plaque to build up, leading to atherosclerosis. Atherosclerosis increases your risk of heart attack and stroke. When arteries in the heart are blocked, a heart attack can occur. If blood flow to the brain is blocked or the blood vessel bursts, a stroke can happen. Both conditions are life-threatening and require immediate medical attention. What is the prevalence and impact of cardiovascular disease? High blood pressure is a global health concern affecting millions worldwide. In the United Kingdom alone, cardiovascular disease contributes to a quarter of all deaths. The condition affects some groups more than others. For instance, people from South Asian and Black groups are at higher risk. Similarly, cardiovascular disease also accounts for 1/5 of the life expectancy gap between the most and least deprived communities in England. Early detection, lifestyle changes, and medication can help manage the condition and reduce its impact. Lowering blood pressure can really lower the risk for heart disease by 17%, stroke by 27%, heart failure by 28%, and even the chance of dying from any cause by 13%. What are the common causes of hypertension? In most cases, the exact cause of high blood pressure is unknown. This is called primary hypertension. However, several factors can contribute to its development. These include genetics, age, diet, and lifestyle choices. Secondary hypertension, on the other hand, has a specific cause. This could be a kidney problem, adrenal gland tumor, and other hormonal or endocrine problems. Certain medications, for example, long-term corticosteroids, non-steroidal anti-inflammatory drugs, or combined oral contraceptive pills and recreational drug use can cause hypertension. Identifying the underlying cause is essential for effective treatment of secondary hypertension. How to measure blood pressure in the clinic? Blood pressure is measured using a device called a sphygmomanometer. Digital machines are now predominant in stores. Palpate pulse prior to taking the blood pressure, as an irregular pulse may affect automated BP monitors. Use an appropriately sized cuff. Measure BP in both arms. If the difference in readings between arms is greater than 15 mm mercury, repeat the measurements. If the difference is greater than 15 mm mercury on the second measurement, measure subsequent BPs using the arm with a higher reading. If the initial BP is between 140/90 to 179/119, offer ambulatory or home BP measurement. For those at risk of postural hypertension, like those over 80Y, or with type 2 diabetes, or have significant falls or postural dizziness, BP is recommended to be checked sitting and standing. If there is a significant drop, equal to or greater than 20 mmHg in systolic BP on standing for 1 minute from sitting, lying, standing blood pressure readings should be used for subsequent monitoring BP readings. The systolic pressure, or top number, represents the pressure when your heart beats. The diastolic pressure, or bottom number, represents the pressure when your heart rests between beats. What are the stages of hypertension? Blood pressure readings are categorized into different stages, typically based on ambulatory or home monitoring. Normal blood pressure is a clinic measurement below 140/90 mm of mercury, or if using ambulatory or home monitoring, 135/85 mm of mercury. Stage 1 hypertension is clinic blood pressure ranging from 140/90 to 159/99 mmHg, and subsequently ambulatory blood pressure monitoring. Daytime average or home blood pressure monitoring average blood pressure is 135/85 to 149/94 mmHg. Stage 2 hypertension is clinic blood pressure of 160/100 or higher, but less than 180/120 mmHg. And subsequently ABPM daytime average or HBPM average blood pressure is 150/95 mmHg or higher. Hypertensive crisis requiring immediate medical attention is above 180/120 millimeters of mercury. Patients with severe hypertension should have assessment for end organ damage on the same day with aim to starting treatment if end organ damage is identified. If no target organ damage, repeat clinic BP measurement within 7 days or ensure a clinic review within 7 days if monitoring using ABPM/HBPM. Lifestyle changes play a vital role in managing high blood pressure. These changes often include adopting a healthy diet, low in sodium and saturated fat. Regular physical activity is also essential, aiming for at least 30 minutes most days of the week. Maintaining a healthy weight, quitting smoking, and limiting alcohol intake are also crucial. Managing stress through techniques like regular sleep, good work-life balance, mindfulness, and meditation can also help lower blood pressure. In some cases, lifestyle changes alone may not be enough to manage high blood pressure. In such situations, medications may be prescribed. Different types of blood pressure medications work in different ways. Some medications help relax blood vessels, while others reduce the amount of electrolytes and fluid in the body. It's important to take medications as prescribed by your doctor and discuss any potential side effects. High blood pressure not only affects individuals' health but also has significant economic implications. The cost of treating hypertension and its related complications is substantial. This includes hospitalizations, medications, and lost productivity. Primary care clinicians should diagnose and treat hypertension to appropriate targets. This is part of the Quality Outcomes Framework. It intends to promote the primary and secondary prevention of cardiovascular disease through satisfactory blood pressure control. The intermediate outcome can be achieved through lifestyle advice or the use of drug therapy. Investing in public health initiatives that promote healthy lifestyles can help reduce the prevalence of this costly condition. High blood pressure is a serious condition, but it's often preventable and manageable. By understanding the risks, getting regular checkups, and making healthy lifestyle choices, we can reduce the impact of this silent threat. Let's prioritize cardiovascular health and work towards a future where heart attacks and strokes are less prevalent. Like and subscribe to this channel for more health educational videos.